Hello, I'm Dipti Itchhaporia, and I'm the Vice President for the American College of Cardiology. And it's my pleasure to talk to you today about the American College of Cardiology, the new strategic directions. I have no disclosures for this talk. The ACC of today is really comprised of over 54,000 members representing the entire cardiovascular team, with 79% of the membership based in the United States and 21% internationally, representing 141 countries. We have 48 domestic chapters and 42 international chapters, as well as 21 member sections. And you can see that we span the globe, and we certainly have an international presence and have an international strategy to continue to cultivate this international presence. If you look at the ACC in the year 2000, we were 26,000 members, predominantly made up of FACCs. And now in 2020, what you see is that we have the whole entire cardiovascular team included, including international associates in our cardiovascular team, as well as fellows in training. So very different look to the ACC of today. The leadership and governance include, here's a slate of them, including Athena Pappas as president, Bo Walpole as treasurer, and Dan Philbin as secretary and BOG chair, as well as Dick Kovac, who's the immediate past president. Next year, Ed Fry will become my vice president, and Chris Kramer will be the treasurer, and Joe Marine will be the secretary and the BOG chair, with Athena Pappas being the immediate past president. This is the ACC's 2019 to 2023 high-level strategic plan. As you know, the mission of the college is to transform cardiovascular care and improve heart health. The vision is a world where innovation and knowledge can optimize cardiovascular care. There are 4 overarching goals, and the first is increase relevance as the cardiovascular professional home. The second is to generate and deliver actionable knowledge, with the emphasis on actionable knowledge, advance quality, equity, and value of cardiovascular care, and lastly, ensure organizational growth and sustainability. And of course, there are strategies beneath all of this, but these are the overarching goals. Let's talk about the innovation strategy, because this is a very important strategy for the college. And Dr. John Rumsfeld is our Chief Innovation Officer, and he's been leading this for several years now. And now we really have an ACC innovation strategy. And there are 3 overarching buckets. We're going to lead the digital transformation of healthcare. That's the overarching goal. And we're going to do that via virtual care, remote monitoring, and artificial intelligence-driven care. And we're going to do this by doing surveillance, really looking at the landscape for all 3 of these buckets and see what's out there. We're going to have a innovation section with the Leadership Council that helps us to set the priorities of the work that's being done. So there's engagement. And then as Dr. Rumsfeld interacts with industry partners, we look at projects for potential partnerships that can help to further the goals for the college in terms of digital transformation of healthcare. In order to successfully do all of the innovation projects, we recognize that it needs to start with a digital transformation. So ACC has undertaken a strategic goal of having digital transformation. There has been a team that's been assembled. There have been consultants to lay out a strategic map for digital transformation and to look at what are the economics of this and sort of figure out how we're going to lay this out for the next several years to come. But the digital transformation, they came up with a sort of a vision statement, which is to create and cultivate a digital-first ecosystem to provide trusted, timely, and tailored knowledge and tools accessible across all touch points of cardiovascular care delivery. Another big strategic priority for the college is this movement to clinical guidance and actionable knowledge. Remember, actionable knowledge was front and center in our strategic plan. And there are 2 components to it. One is to do guideline optimization, which has been done, and I'm going to be telling you more about that, but also to look at all of the guidance documents and tools that we're right now producing, apps, expert consensus decision pathways, and then say, how can we enhance these and move towards the true clinical guidance that our members would need and want. A really successful clinical guidance has been provided recently through the COVID-19 Hub. The COVID-19 Hub has been very successful with 2.3 million unique views since the Hub was launched. There are many features of this Hub that make it very attractive. There were clinical guidance documents, there was advocacy and policy updates, journal scans and expert commentary, quick links to JACC and CardioSmart education, as well as MedAxiom resources. There were webinars, podcasts, and video archives. And finally, there was clinician well-being tools that were recognized to be very important during this pandemic. There was also an international section on this COVID-19 Hub that allowed our international partners to share their views from around the globe. Let's talk about guideline optimization. The guideline optimization was directly done in response to many criticisms about how long it took to produce these guidelines. And so the guideline optimization process included 31 recommendations to clarify roles and responsibilities, increase efficiency, and integrate continuous improvement. And it is a phased implementation through 2022. And really the expected results are to reduce the production time by 50% from 28 months to 14 months, and really to lay the groundwork for a living guideline. And so it's easier to search and easier to update. So the anticipation is that the first guideline to achieve production schedule of 14 months will be 2022. And so in terms of this actionable knowledge, we know that it all starts with science and quality. The goal is actionable knowledge and clinical guidance. And we believe that digital transformation, innovation, education, and advocacy will all be enablers of this. But really the overarching goal here is that ACC should be the global leader in actionable knowledge and clinical guidance. Our next big strategic goal is diversity and inclusion. You know, diversity inclusion, as Eugene Yang said, we are witnessing a revolution in medicine through technologies that are globalizing healthcare. If we're going to succeed in cardiology during this transformation, we need to embrace diversity from all angles, including race, gender, religion, and sexual orientation. So really our challenge was to say that we need to work on our diversity and inclusion. We recognize that preventing and treating heart disease requires a workforce that is as diverse as the patients seeking care. And unfortunately, that isn't the case right now. And so therefore, we must create a culture and a profession that's recognized for its diversity and inclusiveness. When you look at the US population and then look at adult cardiology tends to be less diverse in the population. If you look at the Hispanic population in the United States, in this graph, it shows 17%, but we have 5% in cardiology. If you look at women in the United States, over 50% of the population is women, but yet we have 10% representation in cardiology, although this is increasing. We know that there is a business case for diversity with increased profitability, creativity, stronger governance, better problem-solving abilities, and more growth opportunities. And so this survey of diversity and inclusion showed that the companies with below diversity scores did not do as well as the companies with above average diversity scores. And so there's clearly a case for diversity and inclusion with increased profitability, creativity, and more growth opportunity. But we also know that more diverse management teams have 19 to 33% higher revenues. And lastly, almost half of all millennials, 75% of the global workforce by 2025, will choose a diverse and inclusive workplace. And so given all of this, we have this alignment of ACC's mission and vision with really the D&I vision. And so that vision is ACC will harness the power of diversity of its members to advance patient care, spur innovation, and improve health equity amongst individual patients and populations. And in doing so, ACC will ensure opportunity for all cardiovascular providers by working towards a fully inclusive organization and profession. And so what we did was to actually put diversity and inclusion in our strategic plan under the increased relevance as cardiovascular professional. And so as we did that, there were clearly 3 buckets that came out. One was that there needed to be membership diversity, there needed to be leadership diversity, and there needed to be inclusion. As we know, diversity is not the same as inclusion. And at the center, the strategic plan would support that. We would create strategic partnerships, and a D&I task force was born. And so when we talked about the mitigation strategies for D&I, we looked at pipeline programs and said, we need to create more deep and immediate pipelines. We needed to talk about partnerships with partners such as ABC, the Association of Black Cardiologists, the AAMC, and ACGME, as well as the program directors. And then, of course, the birth of the ACC Diversity and Inclusion Task Force, which really came to fruition in early 2017. And then this task force went underway to address the leaky pipeline. And so program 1 addressed the middle school, program 2 addressed Young Scholars Program, program 3 looked at the pre-med pipeline strategies, program 4 looked at the medical student strategies, program 5 looked at the medical resident pipeline, and then the last one, program 6, looked at the cardiology fellows. And really the strategy was to say we've got to create this pipeline of leaders that not only reflect the membership, but our patient population. So we embarked on building the bench of leaders. And so there were leadership programs that were created by creating ACC pipeline programs, such as the Leadership Academy, which is a 2-year program for early career members. And this really teaches them about leadership. And really, this has become the pipeline for our future leaders. We're in the 4th cohort of this Leadership Academy. We also have the clinical trials research, which is upping your game. This is a 2-year program with mentorship, development, research, proposal, and experience. There's also the overall workforce leadership pipeline, which we're working on by collaborating with cardiovascular societies on developing D&I leaders. So we know that our solution is to create more diversity and inclusion. And one of the ways that we're embarking on this is by launching the Campaign for the Future. And this campaign is to help transform this cardiovascular profession through this more diverse and inclusive, and really by creating more leadership development programs for women and underrepresented minorities, creating these focused fellowships and scholarship programs, by having faculty programs, faculty training programs for diversity and inclusion, and also national and local student outreach programs. All of this is done through funding that we can get from the Campaign for the Future that ACC has embarked on. When we look at the ACC's diversity and inclusion, we had the 1.0, which was really understanding what the principles were, looking at the workforce issues, looking at the business case for it, and then creating the task force and working on mitigation plans. In terms of 2.0, there was definitely a cultural shift that occurred at the college. This was included in the strategic plan, and there were partnerships that were created. There was education with things like implicit bias training that occurred, as well as advocacy that was involved with creating some basic principles with regards to this. But now we're into 3.0, which is a broader definition, and really the focus is on health disparities and health equity. I mentioned to you earlier that inclusion is different than diversity, and I think this slide really says that diversity is being invited to the party and inclusion is being asked to dance. So we wanted to go beyond diversity and really do inclusion. So there were inclusion principles that were done, but really 3.0 is about equity. So we have diversity, we have inclusion, but there needed to be equity. So now it's DE&I, which is diversity, equity, and inclusion. And let's talk about what equality is versus equity. And so equality in this first image is assume that everyone will benefit from the same support. They're being treated equally. In the second image, individuals are given different supports to make it possible for them to have equal access to the game. They're being treated equitably. But in the third image, all three can see the game without any supports or accommodations because the cause of the inequity was addressed. The systemic barrier has been removed. And that's really what we talk about when we talk about equity. The definition of health equity by the CDC is that health equity is achieved when every person has an opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. And as a result of this emphasis on health equity, a health equity task force was launched, and I'm the chair of that task force. And we have really 5 overarching areas that we're going to be focusing on: improving access to care for underserved patients and populations, reducing system and structural barriers which cause health disparity, addressing the socioeconomic determinants of health, leveraging our established tools for broad changes such as education and public policy, and really building partnerships with effective leadership organizations to really promote health equity. And so we created this pictorial for our first task force meeting, which was paving the road to health equity. And we said the 3 pillars of the college are science and quality education and advocacy. And so we created 3 work groups within the task force that are going to look at those 3 areas on the road towards health equity, where everyone has the opportunity to be as healthy as possible, and really creating the infrastructure, so the organizational structure and functions that support health equity. And so a big goal that the task force will be around for 1 year, and hopefully will set a strategic plan of work that can be continued for many years to come. Mahatma Gandhi said, "Our ability to reach unity and diversity will be the beauty and the test of our civilization." And so this was a slide that I put up during our first task force meeting, because I think that there's a lot of energy around doing this work. And so 2021 really has been full of significant environmental changes with the pandemic. It has created a lot of resources to be stretched and overburdened at times. We've had financial issues both at the system level, individual level. We've had the social distancing requirements, so there has been no in-person meetings and the travel restrictions. All of these obviously have created a lot of stress and maybe some opportunities. But what does all of this mean for the ACC? Well, we've certainly shifted from the live meeting to virtual meetings. We have really embraced the notion of clinical guidance with our COVID hub. We have had an increased focus on clinician well-being. And we've increased our focus on diversity and inclusion by saying that we're going to include equity and really focus on health equity this year. There's been a commitment to innovation and digital transformation that has also occurred. And so I think that what Franz Grodel said is true, that we will meet the future not merely by dreams, but by concerned action and inextinguishable enthusiasm. And so I would say that we continue to have concerned action and a lot of enthusiasm for all of the work that's being done at the college with these very strong strategic priorities. And really, I think at the end of the day, it's about advancing solutions to save hearts and lives now and always. Thank you very much for your attention.